Hello class, this is the video review for examination 7 and let's get started. What is true about alcohol-based sanitizers in terms of where they're used or what's the best use for that type of sanitizer? What type of disease is transmitted by animals? Is it tuberculosis, colds, MRSA, or influenza? How can you acquire an infectious disease? And what are some ways that might be myths as far as how you might acquire an infectious disease? What's the body's first line of defense against a pathogen? What cell is incorrectly matched with its function? If I gave you 4 choices: macrophages gobble up bacteria, regulatory T cells kill virus-infected cells, B cells produce antibodies, or helper T cells activate B cells. Again, which cell is incorrectly matched with its function out of those choices? What does nonspecific immunity involve? What are lymphocytes? And what is inflammation classified as in terms of being a nonspecific immune response or an allergic reaction? Is it a specific immune response or is it a herd response? The success of vaccines relies on what type of immune cell? What are some truths and myths about active and passive immunity and vaccines? Why has the incidence of allergies increased in recent years? What are allergies as a result of? What is anaphylaxis? Why can't colds be treated with antibiotics? What are some truths and myths about influenza? What are the differences between a bacteria and a virus? What disease causes the lymph nodes and tonsils to become enlarged? What does the rhinovirus typically cause? Genital warts, colds, tuberculosis, or herpes? When people suddenly acquire a disease throughout the world, is it a sporadic, an endemic, a pandemic, or an epidemic? In 2009, H1N1 started in which animal? What does the Epstein-Barr virus cause? Meningitis are thin membranes that surround the heart, line the urinary tract, line the heart including the valves, or surround the spinal cord and brain. What type of hepatitis is the primary reason for liver transplants in the United States? A, B, C, or D? What is true about hepatitis A, B, C, and D? What are some of the truths and myths about bacteria? What is an antibiotic used for, a bacteria or a virus? What are the 2 most common types of bacteria that cause meningitis? Staph, S-T-A-P-H. Staph may cause what type of problems, short and long term, in people? In 1980, more than 800 people developed toxic shock syndrome and 38 died from it. What was this outbreak linked to? If someone has MRSA, what is true about MRSA? Untreated strep throat, if an antibiotic is not used, it can lead to what problem later? If someone came back from a camping trip and noticed a bullseye-shaped skin rash on their arm, what disease do they probably have? What is Lyme disease? What is true about tuberculosis? And what, if any, are considered emerging diseases? What's the only way to avoid getting the West Nile virus? What is a pinworm infection most commonly found in? Sexually active teens, young children, homosexual men, or drug abusers? What is true about sexually transmitted infections? There are 30 different causes. Women are less at risk than men. They're not very common. Or people under the age of 25 are less vulnerable. What body system does HIV most affect? And HIV can be transmitted in which ways? Mother-to-child transmission of HIV occurs in all of the following ways except kissing the baby, during childbirth, breastfeeding, or during pregnancy. How is hepatitis B most commonly spread? What is true about herpes? Which sexually transmitted infection can cause cancer? The Gardasil vaccine is recommended to prevent gonorrhea, chlamydia, herpes, or HPV. What is a possible outcome of pelvic inflammatory disease? Is it infertility, opportunistic diseases, rheumatic fever, or cancer? What raises a woman's risk of contracting pelvic inflammatory disease? What is a canker associated with which sexually transmitted disease? If someone has a small tumor called a guma and it appears, why over a long period of time would this type of small tumor-like growth appear? Is it because of untreated HIV, syphilis, streptococcal pneumonia, or rabies? And painful urination and a green, yellowish vaginal discharge and itching are symptoms of what sexually transmitted disease? And that concludes Examination 7 video review. Best of luck.